It's a cold Tuesday morning in January. You're sitting in your favorite chair sipping coffee when the phone rings. It's your doctor's office. The nurse on the other end sounds nervous. She says, "Mr. Johnson, we just received word from Medicare. Your scheduled MRI next week. It's been denied. They're saying it requires prior authorization and the request is still under review." Your heart sinks. You've been waiting months for this scan. Your knee has been getting worse. The pain wakes you up at night. And now, the very Medicare program you've trusted for years is telling you no. You ask the nurse, "What do I do?" She pauses. Then she says, "Sir, if you want the MRI right away, you'll have to pay for it out of pocket. It's around $3,000. $3,000? Just for one scan." Your hands start to shake. You think about your bank account. You think about your wife's medicines. You think about the property taxes due next month. And you wonder, when did Medicare change? Why didn't anyone tell me? My friend, if this scenario makes your stomach drop, please take a deep breath and stay with me, because what I'm about to share with you could be the difference between a financially stable retirement and a medical bill that drains your savings overnight. Hello, I am Masha, a Senior Policy Analyst and retirement finance expert here on TaxWise Seniors. My job is to translate the complicated rules of Medicare, Social Security, taxes, and banking into clear, plain English, the kind I would use sitting across the kitchen table from my own grandmother. Today, I'm going to walk you through 5 real changes that Medicare quietly made for 2026. Most seniors haven't read about them. They weren't announced on the evening news. They were buried inside the annual Notice of Change letters mailed in September of 2025, letters that most people set aside without reading. I'll tell you exactly which change has the potential to cost you tens of thousands of dollars. I'll give you the names of the 6 states where a new Medicare rule just went into effect. And I'll show you the 3 free government tools that can protect you starting today. And please stay with me until the very end, because there is one mistake that thousands of Medicare Advantage enrollees are making in 2026. A mistake that's causing them to lose grocery cards, transportation benefits, and even chronic disease support, without even realizing it. I'll explain exactly what to do about it. Let me tell you about Henry. Henry is 71 years old. He's a retired plumber from Phoenix, Arizona. He worked with his hands his entire life. He raised 3 kids, paid off his small house, and saved carefully for retirement. Henry lives on Original Medicare, plus a Medigap plan, plus a standalone Part D drug plan. He's the kind of man who reads his mail, pays his bills on time, and trusts the government to do right by him after a lifetime of paying into the system. Last fall, Henry started having sharp pain in his lower back. His doctor recommended an MRI to rule out a herniated disc. Henry didn't think twice. He had Original Medicare. He'd always heard, Original Medicare doesn't need prior authorization like those Advantage plans. So when his doctor scheduled the MRI for January 15, 2026, Henry felt confident. But on January 12th, Henry got the phone call. His MRI had been flagged under a brand new Medicare pilot program called the WISER model. It stands for Wasteful and Inappropriate Service Reduction. Starting January 1st, 2026, Original Medicare beneficiaries in 6 states, including Henry's home state of Arizona, now have to go through prior authorization for certain procedures. And the reviews are being done by technology companies that get paid based on how much money they save Medicare by denying claims. Henry was furious. He called his doctor. He called Medicare. He waited on hold for hours. And by the time he finally got an appeal started, 2 more weeks had passed. His back pain got worse. He couldn't sleep. He couldn't drive. And he was facing a choice no senior should ever have to face: pay $3,000 out of pocket, or wait, possibly for months, hoping the appeal would go his way. What Henry didn't know is that he had legal rights from the moment his procedure was denied, rights that could have sped up his appeal in days, not months. Rights I'm going to share with you right now. Let me walk you through the 5 real Medicare changes for 2026 in plain English. Change number 1. Your Part B premium and deductible just went up. In 2026, the standard Part B monthly premium is now $202.90. That's up almost $18 from $185 in 2025. The Part B deductible is now $283, up from $257. The Part A hospital deductible is now $1,736 per benefit period. And if you have higher income, the IRMAA surcharge could push your monthly Part B premium up to nearly $690. Here's the trap. The 2026 Social Security cost of living adjustment is 2.8%. But for many seniors, the premium increase eats most or all of that raise. Your check goes up, but your take-home stays about the same. And here's something even more important. If you had a one-time income spike in 2024, maybe you sold your house, took a big IRA withdrawal, or did a Roth conversion, that income is what determines your 2026 Medicare premium. You could suddenly be hit with hundreds of dollars in extra monthly charges because of a single financial event from 2 years ago. The protection is a form called SSA-44. If you've had a life-changing event like retirement, the death of a spouse, divorce, or loss of pension income, you can file SSA-44 with the Social Security Administration and request that your IRMAA surcharge be reduced based on your current income, not your 2024 income. Most seniors have never heard of this form. Now you have. Change number 2. The Part D prescription drug cap is now $2,100. In 2025, the Inflation Reduction Act introduced a $2,000 annual cap on what you pay out of pocket for prescription drugs. In 2026, that cap rose by $100 to $2,100. The Part D deductible also went up to $615. Now, this cap is a huge protection. It means no senior with Medicare drug coverage should pay more than $2,100 a year for covered prescriptions. But here's the trap. The cap only applies to drugs that are on your plan's formulary. If your drug isn't on the formulary, it doesn't count toward the cap. And plans have quietly moved many drugs to higher tiers, called Tier 4 and Tier 5, to make up for the cap. Your copay for those drugs could have jumped dramatically without you noticing. The protection is something called the Medicare Prescription Payment Plan, or M3P. Instead of paying $2,100 in one painful pharmacy bill, you can spread it across the year at roughly $175 a month. If you participated in 2025, you were automatically re-enrolled for 2026. If you didn't, you can sign up by calling your Part D plan. Change number 3. And this is the big one. Prior authorization now applies to original Medicare in 6 states. Starting January 1, 2026, if you live in Arizona, New Jersey, Ohio, Oklahoma, Texas, or Washington, your original Medicare may now require prior authorization for certain procedures, devices, and services. The pilot is called the WISER model. It runs through December 2031. It could affect up to 6.4 million original Medicare beneficiaries. Let me say that clearly so you don't miss it. Arizona, New Jersey, Ohio, Oklahoma, Texas, Washington. If you live in one of those 6 states and you have original Medicare, this affects you starting now. Here's the trap. Most original Medicare beneficiaries believe prior authorization only applies to Medicare Advantage plans. That was true for decades. It is no longer true in these 6 states. And the review companies that decide whether your procedure gets approved are paid based on the money they save Medicare by denying claims. Read that again. They make more money when they deny you. Your protection is the 5-level Medicare appeals process. The very first step is filing Form CMS-20027, the Medicare Redetermination Request Form. If your health is at serious risk, you can request what's called an expedited appeal, which has to be decided within just 72 hours. And you can get free help from your state health insurance assistance program, known as SHIP, by visiting shiphelp.org or calling 1-8778-392-675. This is free. It's funded by the federal government. Use it. Change number 4. Medicare Advantage supplemental benefits were cut. In 2026, a major pilot program called the Value-Based Insurance Design Model was terminated. More than 7 million Medicare Advantage enrollees lost access to extra benefits like grocery allowances, transportation to doctor's appointments, prescription assistance, and chronic disease support. On top of that, Medicare also restricted what types of supplemental benefits Advantage plans can offer at all. Some plans that used to give you $100 a month in grocery money no longer do. The trap. Many seniors join Medicare Advantage specifically for the grocery card or the transportation benefit. They assume those benefits would always be there. But each September, your plan mails what's called the Annual Notice of Change, or ANOC. If you didn't read it, you may not realize your benefit is gone until you try to use it. The protection. From January 1st through March 31st, 2026, you're in the Medicare Advantage open enrollment period. You can switch to a different Medicare Advantage plan, or you can return to original Medicare. Use the Medicare Plan Finder at medicare.gov/plan-compare. For 2026, it now includes doctor and provider directories, so you can check before switching. And if you discover the Plan Finder gave you wrong information in your first 3 months, you qualify for a special enrollment period to switch again. Change number 5. 10 major drug prices just dropped. As of January 1st, 2026, the first 10 Medicare negotiated drug prices took effect under the Inflation Reduction Act. These include Eliquis, Jardiance, Xarelto, Januvia, Farxiga, Entresto, Enbrel, Imbruvica, Stelara, and certain insulin products like Fiasp and Novolog. If you take any of these medications, your out-of-pocket costs just went down significantly. CMS estimates $1.5 billion in beneficiary savings for 2026 alone, and starting in July 2026, eligible Medicare beneficiaries can get popular GLP-1 weight loss drugs like Mounjaro, Ozempic, Wegovy, and Zepbound for just $50 a month, if they qualify based on body mass index and certain health conditions. The trap. You only get these negotiated prices if you use a Medicare Part D plan or a Medicare Advantage drug plan. If you buy these drugs through alternative channels, including the new direct-to-consumer portal called TrumpRx, you bypass the discount, and the purchase doesn't count toward your $2,100 cap. Your protection. If you have low income, apply for extra help, also known as the Low-Income Subsidy, at ssa.gov, or by calling 1-800-77-21213. Extra help can reduce or eliminate your Part D premiums, deductibles, and copays entirely. Now, the hidden mistake I promised you at the beginning. The mistake is this. Most Medicare Advantage enrollees never read the Annual Notice of Change letter that arrives in their mailbox every September. It's a thick, boring envelope. It looks like junk mail. Many seniors throw it away or set it aside and never open it. But that letter is the single most important piece of mail you receive each year. It tells you exactly which benefits are changing, which drugs are being added or removed, which doctors are leaving your network, and how much your costs are going up. If you don't read it, you won't know your grocery card is gone until you try to use it. You won't know your doctor left the network until your next appointment is denied. You won't know your medication moved to Tier 5 until you get a $400 copay at the pharmacy. So please, the moment any envelope from Medicare or your Medicare plan arrives, open it that day. Read every line. Highlight what's changing. Call the plan if you don't understand something. Use SHIP for free help. Now let me give you 3 exact steps to protect yourself, starting today. Step 1. Visit medicare.gov/plan-compare and run your prescription list and your doctors through the 2026 Plan Finder. This is free, official, and government-run. It will tell you exactly which plans cover your drugs and your doctors at the lowest cost. Do this now, even though open enrollment ended in December. Why? Because if you're in the Medicare Advantage open enrollment period from January 1st to March 31st, you still have one chance to switch. Step 2. If you live in Arizona, New Jersey, Ohio, Oklahoma, Texas, or Washington, talk to your doctor before any major procedure. Ask, is this service on the Wiser Prior Authorization list? Do we need approval first? Get the answer in writing if possible. And if you ever receive a denial, file Form CMS-20027 immediately and request an expedited appeal if your health is at risk. Step 3. Call your local SHIP counselor for free, personalized advice. Go to shiphelp.org or call 1-877-839-2675. SHIP counselors do not sell insurance. They don't earn commissions. They are trained, volunteer experts funded by the federal government specifically to help seniors like you understand Medicare. Most seniors don't even know SHIP exists. Now you do. Use it. Before I let you go, I need to remind you of something important. Do not rely only on YouTube notifications to keep up with Medicare changes. The algorithm changes. Notifications get missed, channels get suppressed, Medicare updates its rules every year, and the official source is always Medicare.gov. Sign up for a free My Medicare account so you can see your coverage online. Read every letter from your plan the day it arrives, and share this video with the seniors you love, your spouse, your siblings, your church friends, your neighbors. One conversation could save someone from a denied procedure, a lost benefit, or a surprise bill they can't afford. Open enrollment for your 2027 Medicare coverage runs from October 15th to December 7th, 2026. Mark your calendar now. Don't let another year slip by without comparing your plan. If this video helped you, please give it a thumbs up. Subscribe to TaxWise Seniors and turn on the notification bell so you never miss an important update. And leave a comment below. Tell me which Medicare change worries you most, and let me know if you live in one of the 6 prior authorization states. I am Masha. Thank you for trusting me with your time today. Stay informed, stay protected, stay healthy, and I will see you in the next video.